Welcome back to Morning in America. It's time now for a roundup of some of the top headlines this week. At the top of the list, more questions and concerns on the safety of what we're eating. Just this week, at least 75 people across 13 states have been sickened as a result of an E. coli outbreak associated with McDonald's Quarter Pounders. There's another Listeria recall to tell you about. Let's welcome physician and CETA Med founder, Dr. Lipi Roy. Doc, welcome back.
Great to see you, Hena, as always.
Always great to see you. We have to talk about this E. coli outbreak linked to onions from Quarter Pounders. What signs should we be looking out for?
Yeah, so the CDC report released a food safety alert earlier this week showing that about 75 people in over 13 states as of yesterday were infected with this E. coli 0157H7 strain. That's a specific strain that releases a toxin that can really make people sick. So this is a foodborne illness or food gastroenteritis. So some of the typical symptoms that you would see are diarrhea, often bloody diarrhea, but not always, severe vomiting, dehydration, stomach cramps, and signs of dehydration would be you're not peeing as much or urinating as much, your dry mouth, and you could also have lightheadedness. So these are some of the things that people should be looking for.
And we also mentioned a Costco recall. A few months ago, we were telling our viewers about the boar's head outbreak linked to Listeria. Why are these outbreaks escalating? We're hearing about them more and more.
Yeah, so E. coli, that 0157H7 is one type of bacteria that causes foodborne illnesses, but Listeria, Campylobacter, Salmonella, there's actually multiple bacteria that can cause a gastroenteritis or foodborne food poisoning. You know, scientists are saying and experts are saying they're attributing this rise to severe climate changes, of droughts, heat waves. So because all of this can affect the temperature and can increase, when bacteria growing when it's really hot and sticky, refrigerators not working, multiple reasons, but it's related to climate. That's what the experts are saying.
Oh, that's terrifying because you don't know what to eat and when you can't.
Absolutely.
Let's move on to allergies. It's fall. It's chilly here in New York. A lot of people still feeling the allergies from the spring and summer. Why is that?
Wow. So what's happening, what we're seeing now is that allergy season is starting earlier and going longer, and allergy symptoms are more severe. Again, scientists are attributing this observation with allergies to climate changes as well. With it being warmer temperatures, delay in frost, and allergens are sticking around longer, so it's exposing people to things like pollen. So that's why they're having allergies longer and more severe.
I do want to switch gears because there's new guidelines when it comes to stroke prevention. That is such an important topic. What are those guidelines, Doc?
Yeah, so the American Stroke Association came out with new guidelines. Just so your viewers know, stroke causes almost 800,000, over 800,000 people are getting strokes every year, and more younger and younger people are getting strokes. We think it's because of increased risk of hypertension, diabetes, lower and more inactivity. These particular guidelines are also focused on more sex and gender specific factors. So there's a link with endometriosis, premature ovarian failure. So we need to watch out for this, and early menopause. All of these can be risk factors for stroke. So people need to look out for FAST, F-A-S-T, facial drooping, one-sided arm weakness or numbness, slurred speech, and then T is if you see any of these symptoms, time to call 911.
Okay, are there those guidelines? What can women especially incorporate in their everyday lives?
Yeah, great question. Really the same things that we recommend for my patients for all types of stroke prevention, which is make sure your blood pressure is well controlled, prevent or aggressively treat diabetes, high cholesterol, and really make sure you have an active lifestyle. You don't have to run a marathon. You can just be active 20 minutes every day or 30 minutes 5 times a week can significantly reduce your risk factors. That and just a good diet that's low in saturated fats, low in salt, all of these things can significantly reduce your risk of getting a stroke.
And maybe lay off those Quarter Pounders.
Maybe, yes.
Dr. Lipi Roy, always a pleasure. Thank you so much.
Absolutely.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.